Canagliflozin and renal outcomes and type 2 diabetes and neurolapse. Definition: fasting blood glucose 126 mg/L or random glucose 200 mg/L x2 or 75 g or glucose right. Test y 2 hours post glucose 200 mg/L or hemoglobin A1C.
Canagliflozin and cardiovascular and renal events in type 2 diabetes. Canagliflozin is a sodium glucose cotransporter 2 inhibitor that reduces glycemia as well as blood pressure, body weight, and albuminuria in people with diabetes. We report the effects of treatment with canagliflozin on cardiovascular, renal, and safety outcomes. The CANVAS program integrated data from 2 trials involving a total of 10,142 participants with type 2 diabetes and high cardiovascular risk. Participants in each trial were randomly assigned to receive canagliflozin or placebo and were followed for a mean of 188.2 weeks. The primary outcome was a composite of death from cardiovascular causes, non-fatal myocardial infarction, or non-fatal stroke. The mean age of the participants was 63.3 years, 35.8% were women, the mean duration of diabetes was 13.5 years, and 65.6% 1.97, 95% CI, 1.41 to 2.75. Amputations were primarily at the level of the toe or metatarsal. In 2 trials involving patients with type 2 diabetes and an elevated
Application in medicine. Developing treatment that can prevent or delay the progression of short-circuit disease. SGLT2 are the drugs that improve glycemic control in patients with DM2 that at the moment they are the market, implementing canagliflozin and dapagliflozin.
Six months ago. What they described there was an important benefit in diabetics on 3-point cardiovascular MACE, but importantly there seemed to be a real benefit in one of the secondary endpoints, which is heart failure. And really this is consistent with what's being seen with some of the other SGLT2 inhibitors, and a very hot topic will be whether or not this class of agents may be one of the first to actually make a difference in that particular area. So I know these studies are actually being carried out at the moment. Certainly from a cardiologist perspective, I think we are now at a point where we need to engage much better with our endocrinology colleagues and actually learn about when we should be initiating some of this treatment and how we can partner with them to improve the outcomes of our patients.
This is in Ecuador. At that time, passed a half on the garden, raving some with a medium flow of 262 years. The relative rate of the primary outcome was 30% lower anti-Canagliflozin group and that in the places the group with even rust.
Watch diabetes videos at clearlyhealth.com.
One of the health complications associated with diabetes is damage to your kidneys. Your kidneys filter the toxins from your blood and return the clean blood back into your body. These toxins are then passed into your bladder. The filtering happens inside small blood vessels in your kidneys. High levels of glucose in the blood can damage these blood vessels, causing them to leak. As a result, protein and nutrients are lost in your urine, and some of the toxins remain in your bloodstream, causing serious and possibly fatal complications. A healthcare professional can test for this damage with a yearly urine albumin excretion check and by regularly testing your blood pressure. They can help you find ways to change your eating and exercise habits to lower your risk of kidney disease. By making healthy diet choices, leading an active lifestyle, and taking your prescribed medication, you can minimize your risk of kidney disease.
Pros and cons. Pros: reduce kidney disease, and cons: diabetes, myocardial infarction, strong heads, hospital for hair of flower.
Is diabetes an incurable disease type?
They're so sick. But the diabetes itself is actually quite reversible. And that's one of the things that I realized a short while ago. And that's what needs to be understood, is that this is not a disease that needs to progress. But we often tell people that it's a chronic progressive disease. And that's not simply me talking, but if you go to the diabetes associations, whether it's the American Diabetes Association or the Diabetes Australia, they all put out there that this is a chronic disease. And they tell people essentially that you have diabetes, you'll have it for the rest of your life, you might as well get used to it. But the problem is that that's simply not true. And it's actually pretty easy to prove it, because if somebody came up to me and said, I've had diabetes, I was told I had diabetes, I watched my diet, I lost 50 pounds, insulin down, because the proteins and the fats still raise insulin. Not to the same degree that carbohydrates do, but they still raise insulin. So you can get that sugar down, but you won't get that insulin down. So you can actually put people on various periods of fasting because you're not taking anything. It's not simply low carb, it's low protein and low fat, right? It's nothing at all. So think about what's going to happen here. The body is not going to have anything coming in. So what it's going to happen is it's going to start burning that sugar. And that's perfect. That's exactly what we want it to do. It starts burning sugar. After it burns the sugars, your sugars come down. You don't have to take medications. You don't have to take insulin. After that, it starts burning fat. And that's perfect. That's exactly what we want to do. And there's always two questions that come up when you talk about fasting. One, can I do it? And the thing...
Conclusion: I'm positive with type 2 diabetes and kids diabetes trade rise on kidney failure and cardiovascular event was lower Canagliflozin, rapid anti-intake depletes rapid and medium flow of 262 years.
Bob, I want to ask, what have we learned about the mechanism of action of SGLT2 inhibitors that explains the cardiovascular effects of canagliflozin?
It's a great question. I mean, to be honest, I think the results were surprising, and I don't think many people expected there to be the dramatic effect that there was. And so really trying to figure out why that was is really a little bit of thinking backwards and trying to understand the way the drugs work and therefore what it could do. So what we do know about SGLT2 inhibitors is they result in a little bit of diuresis and volume contraction.